I am Dr. Jun Akatsuka from the Department of Urology, Nippon Medical School, Tokyo, Japan. I would like to introduce our research on medical AI. Machine learning and deep learning technology are growing exponentially into every branch of business and science, including the field of medical science. Currently, patients and doctors have great expectations for the application of AI in various medical fields. Machine learning and deep learning technology are growing exponentially into every branch of business and science, including the field of medical science. Currently, patients and doctors have great expectations for the application of AI in various medical fields. We have been conducting research with doctor-friendly AI research as the central theme. These researches include contents such as easy to understand for doctors and easy to use for doctors. We believe that our work will further the development of medicine in the future. To prepare the explainable model analysis, we conducted deep learning classification using 307 MR images. We constructed an ROC curve with the corresponding AUC to evaluate the classification using AI. Next, we applied an explainable deep learning model to 129 images classified as cancer images by the deep neural network and assessed whether the deep learning focused regions overlapped with the radiologist identified targets based on prostate imaging and reporting and data system. Similarly, we compared deep learning focused regions with pathologist identified cancer locations through 3D reconstruction of pathological images. Finally, pathologists provided histopathological diagnoses and evaluated the deep learning focused regions in the non-overlapping areas. We constructed an ROC curve for classification accuracy using 10-fold cross-validation, which yielded an average AUC of 0.9. This image shows representative images with overlapping areas between deep learning focused regions and genuine cancer locations. Left image group comprises 25 images with overlapping areas between deep learning focused regions and genuine cancer locations. The overlapping areas are colored in green. We found that deep learning identified cancerous regions at various locations in the prostate gland. We examined the differences between deep learning and human approaches in cancer image classifications using an explainable deep learning model. A male in his 60s with a serum PSA level of 10.8. T2-weighted MR image shows homogeneous low signal intensity in the posterior peripheral zone on the right in the posterior portion of the prostate. This abnormal signal intensity was identified as prostate cancer with a Gleason score of 9, along with prostate capsular invasion on the pathological image. Deep learning focused on the cancer region. A male patient in his 50s with a serum PSA level of 9.2. Deep learning focused on a region in the anterior transitional zone where no tumor was present on the pathological image. However, dilated prostatic ducts were observed in the deep learning focused region. The pathological image shows prostate cancer with a Gleason score of 7, mainly in the posterior peripheral zone on the left. A male patient in his 70s with a serum PSA level of 8.1. A T2-weighted MR image shows diffuse and heterogeneous low signal intensity in the transitional and peripheral zone of the prostate. The pathological image shows prostate cancer with a Gleason score of 7 in the posterior peripheral zone. Deep learning focused on normal adipose tissue in the extraprostatic region, which may be an ungeneralized feature produced due to overfitting. We quantitatively analyzed the correlation between the deep learning focused regions in the MR images and expert-identified cancers. Deep learning focused regions overlapped with radiologist-identified cancer targets PI-RADS category 4 by 70.5%. Furthermore, we compared the deep learning focused regions with the pathologist-identified cancer locations. The deep learning focused regions overlapped with pathologist-identified cancer locations by 72.1%. There are several possible reasons for the discrepancy between deep learning-focused regions and expert-identified locations. Deep learning may identify cancer-related features in non-cancerous regions. Our results suggest that dilated prostatic duct and lymphocyte aggregation are possible cancer-related features of prostate cancers. Further, these cases could have been the result of overfitting of deep neural networks. Overfitting is a problem that occurs when the algorithms fit the training data too closely, which affects generalization. There are several methods for reducing overfitting in deep learning classification. Deep learning may find not only ungeneralized features outputted through its overfitting to the limited dataset, but also genuine medical clues that can help a clinical diagnosis by a physician even if the cancer is not visible in the region, indicating the high potential utility of deep learning in the field of image diagnosis. Integrated analysis of medical multimodal data is a key factor that drives practical technology in the next stage. Even if the predictive power of each datum is insufficient, data integration can improve the predictive power through appropriate machine learning techniques. In this study, image selection itself was performed quantitatively. This is an important step toward more accurate and integrated medical AI. We applied machine learning analyses and used ultrasound imaging data and clinical data to detect high-grade prostate cancer. The AUC using clinical data was 0.691, while the AUC using clinical data and ultrasound imaging data was 0.835. Our data-driven ultrasound approach offers an efficient tool to triage patients with high-grade prostate cancers and expands the possibility of ultrasound imaging for prostate cancer detection. We examined the prostate ultrasound images of the top 5 cases according to their pathological cancer grade based on the predicted probabilities of each class. Ultrasound images of high-grade prostate cancer, left upper images, show an asymmetric prostatic lobe, an unclear boundary of the prostatic capsule, and extensive hypoechoic areas. This slide shows a representative case with a saliency map using an explainable deep learning model. A male patient in his 60s had a PSA level of 5.7 in a routine evaluation. A prostatic biopsy revealed a Gleason score 8 adenocarcinoma in left peripheral zone. He underwent radical prostatectomy, and pathological examination revealed a Gleason score 8 adenocarcinoma. In this case, the results of ultrasound image analysis using an explainable deep learning model and the location of cancer on the prostatectomy specimen were co-located. This result was fascinating and led to an era of doctor-friendly medical AI. Clinical applications of artificial intelligence and its future prospects. At Nippon Medical School, we are promoting AI education for medical students. Worldwide, there have been advancements in the application of AI technology in medical fields. The state of medical care is changing rapidly. Therefore, to create and support next-generation medical care, it is important to develop next-generation AI human resources who have the knowledge and skills of mathematics, data science, and AI while understanding medicine. Our team will continue to promote AI research while practicing clinical and educational activities.